The world is not financially prepared for the next pandemic. This is the position of the World Health Organization and the United Nations at the General Assembly currently underway in New York. Bridget Ngana is on site.
The high-level meeting on pandemic prevention, preparedness and response was the highlight of the series of high-level meetings here at the United Nations General Assembly. WHO Secretary General Dr. Tedros Ghebreyesus calling on world leaders to prepare to finance future global health emergencies.
It's now more than 4 months since WHO declared an end to COVID-19 as a global health emergency. This virus touched every person on the planet in some way. It stole lives and livelihoods and caused massive social and economic upheaval. It exposed and exacerbated vast inequities and wide cracks in our defenses. And it reminded us that we are one humanity.
Today, Africa spends more on debt service costs than on healthcare and education. We need a finance boost so that countries can invest in the universal, resilient healthcare their populations have a right to.
Dr. Tedros' sentiments being in line with calls by experts from the African continent that Africa should be at the heart of future vaccine research, development and also manufacturing.
As a continent, we need to be thinking about innovative, sustainable ways of financing vaccine purchase. Because if this is not done, it means even in the next pandemic, African countries will not be able to afford vaccines. Because when the pandemic strikes, vaccines become gold.
Information that's created can be shared in a way that isn't driven by the intellectual property system internationally, that isn't simply handed over to the big pharmaceutical corporations.
Actually, what we're seeing is when you bring in this private finance, we're seeing wider gaps in inequality. We're seeing a bigger disparity between those that can and those that can't afford. And we're seeing vulnerable people, particularly women and girls and gender diverse groups, being taken advantage of.
According to the UN, countries have so far raised $2 billion to address future pandemics, but the UN also estimates that they need $10 billion annually to effectively prepare for future pandemics.
To deliver a strong pandemic accord and effective amendments to the International Health Regulation by May next year, to ensure equitable access to vaccines, tests, treatments, and other medical countermeasures, to fight back against mis- and disinformation that erodes trust.
On Thursday, President William Ruto is expected to address a high-level meeting on SDG financing. Bridget Ngana, NTV, New York.